Hello, good day everyone. I am Mary Suzanne Canila, your student nurse from Davao Doctors College, BSN 111A. So today, I'm going to perform my return demonstration in eye assessment. Assessing the eyes, reviews client previous medical record if available. Enables easy collection of information which also reduces the need for patient's time. Determine the scope of assessment needed, prepare necessary equipment, so we need Snellen chart and a pen light. Determine to ensure organization, increase efficiency in performing the assessment, perform hand washing to prevent infection and contamination. Greetings the client politely and client's companion if around. Introduce self and verify the client's identity as how the client would like to be called during the assessment and establish rapport with the client. To show courtesy and make the patient comfortable, introducing herself to the client's enhances rapport. Good morning, ma'am. I am Mary Suzanne Canila, your student nurse for today. Can I have your risk, ma'am? Can you state your full name, ma'am?
I am Andongki
Your
Chalimar,
birthday.
July 5, 2001.
Okay, so what do you want me to call you?
Just call me Q.
Okay. Explain the procedure to the client and how or she can participate during the assessment. Provide the client's opportunity to clarify or ask any concern. Reduce the client's anxiety and enhances rapport. Okay, ma'am, you can cooperate with me by moving your specific body during this assessment. So, if you have any clarification or concern, I would be glad to assist you. Enhances clients' comfort, privacy, and confidentiality. Assessment setting was assured to be safe, secure, and free from distraction. Position client to the seated comfortably to ensure to keep personal information to the public and the setting to be comfortable for the client. Yes, ma'am, I assure you that this assessment is disclosed to the both of us for you and your information confidentiality. Are you comfortable with your sitting, ma'am?
Yes, nurse.
Okay. Assessing the visual acuity. Check for use of any visual aids prior to starting the test. Had the client 20 feet, the Snellen or E-chart covered the eye being tested and ask him or her to read each line until she can decipher the letters on their direction. Took 3 readings, right eye, left eye, both eyes. Recorded the readings of each eye and both eyes, from which the person is able to read one half or more than the letters. Prepared selected vision test, light test, perception, hand movements, then counting fingers. Ma'am, may I ask if you wear contact lenses or graded glasses?
No, nurse.
Ma'am, may I invite you to stand up? Now, I want you to use this cardboard to cover your right eye and then by your left eye and then both of your eyes. Try to read the letters written in the Snellen chart just up until the letters you can still see. Is that okay, Queen?
Yes, nurse. E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, P, O, P, Z, D, D, F, P, O, T, E, C.
Next eye.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, F, T, D, E, F, P, O, T, P, E, C.
Okay, ma'am. Thank you. And you can sit back now. Now, I will record the assessment. Ma'am, I want you to tell me how many fingers I am raising.
1, 2, 3.
Okay. Another one, I want you to tell me what direction am I pointing my finger at.
Left, right, up, down.
Okay. Next, I want to tell me if you could see the light, okay?
Yes, nurse. Yes.
Okay. Testing for visual fields. Face the patient directly at a distance of 60 to 90 centimeter. Instructed the client to look directly onto the examiner's eye with both eyes. Place hands about 2 feet apart lateral to the patient's ears. Slowly move weakling fingers of both hands along the imaginary bow until the patient identifies them. Ask the client to tell you when the moving object is first spotted. Repeated the action in the upper and lower temporal quadrants if a defect is detected. Slowly move wiggling fingers from the defective area of the field toward the better version. Tested another iPhone and accompanying the defect. Mom, I just want you to just look straight into my eyes, okay? Mom, tell me by saying if okay if you spot my fingers upon entering your visual field, okay?
Okay, nurse. Okay. 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 Okay.
Okay, I see that you don't have trouble with your right eye, so we still have to repeat the wiggling with your eye. So, ma'am, tell me by saying okay when you first spot my fingers upon entering the visual field. So, let's do it again with the other eye.
Okay. Okay. Okay.
Next is visual inspection of eyes. Visually inspected the eyes for alignment and symmetry, the eyebrows and its hair distribution, and evenness of eyelashes or the direction of curl, as well as the eyelids for surface characteristic. Inspected the area for the lacrimal gland and lacrimal sac for swelling, as the patient to look up and depress the lower lid of the patient with one thumb. Afterwards, to assess sclera and bulbar conjunctivae, then averted eyelid to assess palpebral conjunctiva. Inspect carefully each iris and pupil as well as the cornea and lens for opacity and clarity and texture. Now, ma'am, I will be checking if your eyes are aligned and symmetrically as well are your eyebrows. So, ma'am, raise your eyebrows like this, upward and downward. Okay, ma'am, your eyelashes are evenly distributed. Our curls are slightly upward. Ma'am, please close your eyes. Close your eyes and close symmetrically and have no discoloration and lesions. Now open your eyes. So I will palpate the lacrimal gland and sac, ma'am. I will put my hand into your face. Okay, no edema, no swelling, no tearing of the lacrimal ducts. Ma'am, I invite you to look up. Ma'am, please just look into my eye, please. Okay. Now, I'll be using my pen light to check your cornea and lenses. Okay. Assessing direct and consensual pupillary reaction to light, darken the room, partially are ask the client to look into the distance. Shone a light obliquely into each pupil in turn using a pen light approaching from the side and look for the direct and consensual reaction. So, ma'am, I need to close the light. I'm gonna light your eyes again to check for your direct and consensual reaction. Okay, so for direct, your right eye constricted, and for your consensual, your left eye constricted. By lighting your right eye, and those are normal. Assessing the accommodation, held an object, a pen light or pencil, about 10 cm from the bridge of the client's nose. Ask the clients to look at the top of the object and then a distant object behind the pen light. Instructed patient to alternate the gaze from the near to the far object. Observe the pupil response. So this for the assessment of your pupil's reaction to accommodation. Ma'am, I want you to do is look or focus to the tip of the pen light and then look at the wall at my back. Pen light, tip of the pen light, and then my back. My tip of the pen light and my back. Okay. So, performing Hirschberg test. From about 2 feet directly in front of the patient, shone a light onto the patient eyes and ask the patient to look at, inspect the reflection in the corneas, as well as look for the direct and consensual direction reaction. So, ma'am, I'm going to light your eyes again and just look straight. Okay, so performing the cardinal fields of gaze stays. Stood 2 to 3 feet in front of the patient and ask the patient to follow the examiner finger or a pencil while making a wide etch in the air. Look for jerky movements of nystagmus and watch the rim of sclera. Ma'am, please follow the tip of the pen light with your eyes. Only the steady of your head. Okay, so testing for convergence. Ask the patient to look the examiner pens as the examiner moves it towards the bridge of the nose. Check for convergence. Ma'am, please simply follow the pen. Okay. For the summary and closing phase. Summarize the information obtained during the work phase and discuss the findings to the client. Discuss to the clients possible to resolve the health concern if present. Assess the client's understanding of the plan and the need for further teaching, and provide the client's opportunity to clarify, ask, or raise any concern. Thank the client and ended the interview politely. Perform hand washing. So, ma'am, I will be now summing up everything we've covered so far for your visual acuity when you were reading the Snellen's chart. The result is your right eye vision is at 20 to 25 and your left side is at 20-25. Also, both of your eyes are at 20-20. Okay, ma'am?
Okay, nurse.
For visual fields, the one which I did when I was wiggling my fingers, so your upward field is at 50 degrees and your downward field is at 70 degrees and your nasal field is at 50 degrees, which is normal. For the inspection of the eyes are aligned and symmetrical. The eyebrows are evenly distributed, eyelashes are evenly curled up, and for the eyelids, skin are no intact or asleep symmetrically. No discharges, so discoloration, normal blinking, which is at 15 to 20 blinks per minute. As I was palpating for your lacrimal glands and your ducts, there was no edema, no tenderness, no swelling or tearing. For sclera, which is normal as well, your vulvar conjunctiva 2 is good. Iris and pupil are both normal and no opacities. Your pupil's reaction to accommodation is normal too. Cardinal Fields gait test, both eyes are coordinated and no jerky movements. So far, everything is normal. There is no need with your problem in your eye screen. But I just wanna ask you to minimize exposure to gadgets and continue to consume vitamin A. That is good for your eyes. If you have clarification and question, feel free to say that I can address you. So, ma'am, our queen, I think this is all. Thank you for your time and cooperation.